guys. All right, so I am on my way to the plastic surgeon who specializes in eyes. Have a million before pictures. You've seen it. If you've seen any of my videos, you know how bad they are. I've taken videos without makeup, so you're certainly aware of how bad they are. And I'm able to fill them in today and make them at least look a little bit better so that I don't look so tired.
My channel. All right, so this is a video I've been thinking about doing for quite some time. So if you just saw the little snippet before this, you saw that yesterday I was on my way to hopefully go to the plastic surgeon and have these under eye troughs, have filler put into my under eye troughs. Well, I met with a plastic surgeon that specializes in eyes. That's pretty much all they do. I mean, they do a few other little face things, but eye surgery, eye fillers, eye cosmetic surgery, eye correction surgery. This is what they specialize in. And this plastic surgeon was very sweet. I had never met him before. And so he took one look at my eyes and he said, he knew from my form that I had had thyroid surgery, or thyroid cancer. That's what this scar is here. And he said, did they diagnose you with thyroid disease before thyroid cancer? Those are two different things. And I said, yes, I was diagnosed with Hashimoto's. And he said, yes, because I have thyroid eyes. I'm like, what does that mean? So all that puffiness here and the wrinkling here has to do with my disease. And I said, great. So it's not just the old age. It's actually to do with the thyroid disease that I had. So unfortunately, we could have put the filler in, but it would have just made the under eye wrinkles worse. So we would have correct one thing and make another thing worse. So really my only option is surgery, and I will be doing it, but it will not be until next year because we will be going to Disney. There's no time to do it beforehand. I thought this would be a good opportunity for me to do this video that I've been wanting to do, and that was on my thyroid cancer, how I was diagnosed with it, how the surgery was, how the after surgery, how I'm doing now. So let's just jump in. Back in 2009, 2010, and a TIA is a mini stroke, and I had it from a chiropractic adjustment. So when I had the MRI done, they found incidental nodules on my thyroid. And after this mini stroke was taken care of, I went to an endocrinologist who did thyroid tests, which are testing for antibodies, and my antibodies were out of whack, and I had what's called Hashimoto's, which is an autoimmune disorder. So there's really nothing you do about it. I didn't need medication at that point. So we just watched them for a year, the nodules. So every 6 months I'd go in, we'd do an ultrasound, measure them. Well, 1 year, in 2011, they did an ultrasound, and he said, you know, one of the nodules looks bigger than I would like, and we needed to do a biopsy. So you have your head tilted very, very far back. They put lidocaine. It's a very long, thin, hollow needle that they put into your thyroid, and they will test multiple areas. So they push the needle in, they jiggle it around, and they pull it out to get a sample, and they do that multiple times. Well, I had to have it without lidocaine. It is not fun. It was very uncomfortable. So the results came back in a few days. Now I had an endocrinologist that actually called me on the phone, and you know when people say you should bring someone with you if you're going to your doctor and they're going to give you bad news? It's because you truly do. Once they say the word, and in my case it was papillary carcinoma, well, I work in a medical field, I knew what both words meant. My brain shut off, and he could have been talking about pink flying pigs for all I know, because I heard nothing after the word carcinoma. So he wanted me to meet with him the next day, which I did. I kind of went through the rest of my day as a zombie. Went and met with him, and I still, you know, it's funny, when I had the biopsy, I've never been a smoker. I take relatively good care of myself. Never the smallest inclination did I think, oh, it could be cancer. Never. So I was caught off guard. And I went and met with him, and surgery was the only thing. And there are two types of surgery. There's a partial thyroidectomy and there's a complete thyroidectomy. And let me just preface this by saying I'm not a doctor. This is purely what I went through and what I've read. A partial thyroidectomy, your thyroid is kind of built like in two pieces. It looks like a butterfly. And so you can remove half of it and you still have half. The great thing about that is that you still have a thyroid that works. And boy, you really need your thyroid if you can keep it. Gosh, wish I still had mine, but you know, it had to go. In a complete thyroidectomy, obviously the entire thyroid is removed. Now, you cannot remove every single bit of thyroid tissue because your vocal cords are attached to a portion of your thyroid tissue. Some information for you. So the best thing in the majority of doctors' opinions currently is to remove the entire thyroid. June 9th, 2011, I went in for thyroid surgery. I didn't do a whole lot of research on the internet because I don't want to freak myself out, but I did enough to where I felt like, oh, okay, I kind of have a grasp of what's going to happen. Boy, was I wrong. There's things that I never had read, and there are things that I wish that I had known. So hopefully, if anyone's out there in the same boat, I will be saying some things that you guys might want to know. So for the surgery, it took longer than expected. You know, you go into the pre-op room and they get your IV started and had the surgery, and it was supposed to take 2 hours, but took 4.5. Obviously, I'm asleep, so I don't know what's going on, but they have heated blankets now that they wrap you in. And I remember when I woke up from surgery, I was dripping sweat because I was so hot. I remember that was obviously. And then unfortunately, I was also allergic to the anesthesia and just started vomiting with that was about 4 inches, I think. I'm looking at my scar. It was probably 4 inches in length. You know, I look like Frankenstein, to be perfectly honest. And so I was vomiting and I was sweating, and they brought in a fan, and you know, I was drenched, and they took all that off. And now some people say that they needed pain medication. I did not. The only thing I took were 2 Tylenol afterwards because I had a massive headache from the anesthesia. Wasn't painful in any way, really. I'll tell you what hurt was the swallowing and the back of your neck, because they have your head hyperextended back. So, oh my gosh, it feels, and then you have a drain, you know, and so it's just, you just don't feel right. I mean, don't get me wrong, you feel like crap. Now, couple of risk factors of having this surgery, aside from the anesthesia and all, you know, anesthesias with any surgery, is that they could damage your vocal cords, because like I said, the vocal cords are right there. The other thing is they could damage your parathyroid glands. You have 4 parathyroid glands, and their main function is to regulate your calcium. They're very, very important. They're also very, very, very tiny, like the top of a pen tiny. And you only need 1. So you got 4, you only need 1, and there's times where doctors have actually taken it, they've seen them, they have taken 1 out and they've put it, say, in any other area of your body, because it works wherever it is. In my case, mine were 2 were removed because they were in the biopsy, and the other 2 were damaged. And we know this because we run PTH tests, which is parathyroid hormone tests, and mine show basically under 5, which means that they're non-existent. So I was in the hospital. You will not be released from the hospital until your calcium levels are normal, because you do not want to leave the hospital and your calcium levels go low, because it could hurt your heart. You know, calcium is very important. So I was in the hospital for 5 days, which is longer than you know, you really want to be there. But my calcium would not regulate. Well, it couldn't regulate. The PTH was, now sometimes they're in shock, and sometimes your parathyroid glands will come back to life. But if after 1 year of having no PTH function, then they don't come back. So in my case, they never came back. So for life, I have to take Synthroid, which is you know, because I don't have a thyroid, I need thyroid medicine. And I also have to take calcium for the rest of my life because I don't have any parathyroid glands. And I have to take vitamin D, prescription vitamin D, because vitamin D helps calcium absorb into the body for the rest of my life. So that was kind of there were dissolvable stitches, so they just had this mesh over it, and eventually they dissolved. I had stage 3 thyroid cancer. So when they did do the biopsies, it was stage 3, and they were able to take out, my surgeon was able to take out 7 or 8 lymph nodes, and they were all clean. Now, I'm, as of this year, 6 years cancer free. But for the first 5 years, I had every year had to do an ultrasound and do a blood test to make sure that the cancer didn't come back, because remember, we can't get rid of all the thyroid tissue. And then after 5 years, they say, okay, great, you don't have to do any more testing. So that's where I'm at with regards to the cancer. Well, let me just go back. Some people will need to do radiation therapy. And I did not. I should have, but for some reason my endocrinologist, my original endocrinologist, did not have me do it. My new endocrinologist that I had gotten after the first year, because she was a female, she was just, I feel, better equipped to deal with female issues that are related to losing your thyroid, because there are. Everything changes. It's a regulator, you know? It regulates your temperature. It regulates your metabolism. I would suffer from anxiety, so it just would come over me and I wouldn't be able to breathe. I wouldn't be able to take in a deep breath. Some of the other things is my vocal cords were mildly damaged, so I couldn't raise my voice. I could only talk like this. No matter how hard I tried, this was it. Mine came back after probably about 2 weeks. Difficult for me. I was hot and I was cold and nothing felt regulated, you know, unfortunately. So it took probably a good year to feel normal. Thyroid medication, it takes 6 weeks to know if it's working or not. And then if it's not working and you up the, it takes another 6 weeks. So it takes a long time. It's not like, oh, blood pressure medicine, you can change your blood pressure medicine and you know within a day whether it's working or not. It's not like that. Thyroid medicine takes forever. So it took a good year to get it right. You lose weight or gain weight, 10% of your body weight if you lose, and they never told me that. So I had gained like 40, 50 pounds from losing the thyroid, and then I was working really hard and I lost like 30 pounds, and that was enough to mess up my thyroid again. So I still fight with it to this day of getting the exact right dosage. I have a regulator for calcium, I don't have a regulator for my thyroid, and I don't have a regulator for magnesium, and I'll get to why I don't have that one in a minute, because that was a complication that we would see a couple years down the road. Those are kind of the main things, I guess, is that be prepared to have your hormones out of whack. Today, as far as I know, I am cancer free. Those of you that may be watching this video because you've been diagnosed with thyroid cancer, if anyone has any questions, please put them in the comments and I'll do my best to answer them. Again, I'm not an expert on thyroid cancer. I can only tell you what I went through, but I'm happy to, you know, try and give you any answers that you may need.